Good evening, Mr. J. Teddy and I are ready to crush this test. I hope you're as ready as we are. Zip it up. And now we're ready.
Okay.
All right, here we go. Number one.
Scapular fossa that articulates with the humerus is deepened by an additional structure called the glenoid labrum.
Mm-hmm. Sternocleidomastoid joint's the only bone to bone. That makes sense because the only other one really have is the AC, but then it's connected to the
shoulder to the thorax.
Exactly, because there's no other connection that connects to the thorax.
Yeah. Test for pronator teres pathology. The athlete flex the elbow at 90 degrees.
Rotate against resistance. That's a pronator teres test. Special test.
Yeah, isn't it?
Mm-hmm.
As the form is pulled outward into extension. This is called the pitcher's elbow test. That's not what it's called, though.
No, that's pronator.
It's called the pronator teres test.
Special test, yeah. So I would say false because
it's not called.
It would be weird to be false because it's supposed to be this.
It should be.
I feel like we should answer those things and why. I don't know if we need. Yeah, it's actually the.
I'm just gonna say it's not the name. I'm not getting specific, but it's not right.
Fair enough.
Rotator cuff. Infraspinatus? No, it's the supraspinatus.
Supraspinatus, right?
Continually using the arms above the horizontal plane. This could be caused.
That's supraspinatus because supraspinatus is in the first 30 degrees of extension or abduction.
And it's a humeral head depressor.
Humeral head depressor, and that's true. See, we're going to kick this test button.
A tear detachment of the fibrocartilage labrum from the posterior aspect of the humeral head is a Bankart lesion.
No, posterior is on the anterior portion.
Yeah, this part's right, anterior. But this part's wrong.
Yeah.
So this one's false. The most direct cause of anterior dislocation are situations where the arm is forced into abduction and external rotation.
Yeah, which is our apprehension test. Abduction, extension.
This is caused when a football player arm tackles a running back. Oh no, football.
Yeah.
True.
Apprehension test, mother trucker.
Slammed it.
Oh.
Slammy. Tenosynovitis or tendinosis.
Tendinosis.
Is the long-headed bicep muscles common among athletes who execute a throwing movement. The special test would be a speeds test.
Well, a speeds test does test for biceps tendinopathy, which would make sense.
Which is part of throwing athletes. Yeah, that's true. Anterior instabilities account for 95% of all chronic instabilities. I would say that's the most common, yeah.
Right? I mean, I know it's not.
It's not inferior.
It's certainly not superior.
And it's definitely not multi-directional. Yeah. That
would make sense.
Posterior alignment such as a forward head carriage, rounded shoulders, and weak rhomboids and tight pecs causes a decrease in space under the coracoacromial arch. Leads to thoracic outlet syndrome. Those things lead to thoracic outlet, but is it under the coracoacromial arch? I feel like it's right.
Yeah. Let's see here. Coracoacromial arch is here.
Yeah.
Brachial plexus is up higher.
It goes right under it. Doesn't it go right under it though?
Yeah, it goes underneath it, but like then your artery and everything's underneath here.
Yeah, it's in your
it's more thing. Yeah, it's more in the axillary more than like under the arch. Like, isn't the subacromial arch where your glenohumeral space is?
I can't remember. I think that everything's right except for the space part.
Yeah,
the space under the coracoacromial arch.
I don't like the way that sounds. I'm gonna go with false because I don't like that.
I just don't like it. I think the ligament that stabilizes and encircles the head and blends into the radial collateral. Oh, that's an annular ligament. I remember that one. Doesn't it? Or no, is it the other one? Isn't it? Encircles the head of the radius. Yeah. Right?
Blends into the it's
Are we
blends into the
notes?
Yeah, it's open note. Blends into the radial collateral ligament. That's the part that's gonna be hung. I feel like that's quadrate because annular holds in and provides stability.
I know what you're trying to say.
Provides stability.
Okay. What does it say? Ligament that encircles the head of the radius.
Quadrate ligament.
I like how I don't have like anything on it.
Yeah, I was looking it up in the book earlier. Actually, I got
Haha. I'm pulling out the book. There's my elbow stuff.
Shoulders.
Where's the elbow?
Shoulder. Still shoulder. Elbow. Where's the ligament? Shoulder.
Radial. Okay, so this one blends into the radial collateral ligament.
Mm-hmm.
So here's the radial collateral ligament. The only one it blends into is the annular and accessory.
Mm-hmm.
Right? Yeah. Yeah.
All right. Why am I thinking quadrate? What is that?
Your quadrate's in your shoulder. I don't even think you have a quadrate in your elbow.
Okay, well, it's got to be annular. But the annular comes up later. There's another question that's basically the same thing, but it has something slightly different. That also feels like annular.
I'll star this one so we can come back to it if
Mhm.
we're okay. If resistance is applied to an athlete extending their hand with the elbow extended fully, what test is being performed? Is that medial epicondylitis?
Well, medial is about your flexors. So if the hand is athlete extending hand, extending their hand, elbow fully extended. That'd be a lateral epicondylitis test.
What's it say? Athlete extending their. Is it this one?
Yeah.
Is what they're asking
So we
for?
have flexion and extension.
Okay. That's looking
And
up at me.
for extending their, so yeah, so your extensor muscles go all back to your lateral epicondyle, and all your flexors are
On
for
the
your medial
straight.
condyle side.
Patient hand resists upward motion, resists backhand on lateral epicondyle. Medial epicondyles passively bring the arm up and extend the hand downward.
Mm-hmm.
Okay, so this is extending the hand, so you're
Mhm.
right lateral.
Yep.
Can you remember what extending the hand is?
I know, they're all so weird sometimes, and every joint and chank's a little different.
What structure could be damaged? The pathology could be cubital tunnel syndrome. The ulnar nerve?
Yeah, I mean, the ulnar nerve passes through there because it's 4 and 5, so it can't be flexor digit minimi.
Yeah, those are
Interosseous
just
muscles is not something we've talked about in the
Those are
hand.
also the muscles in between your arm.
Yeah, and the median nerve's not through there.
Yeah. Cubital varus is an abnormality. I'm waiting.
Median nerve, ulnar nerve, yeah. Okay.
Yeah. Cubital varus is an abnormality resulting in increased carrying angle.
It's wrong, it's
It's
cubital valgus.
cubital valgus, right? Too many things. Which of the following muscles is not part of the rotator cuff?
Teres major.
That was a good one because I thought it said teres minor. Winging of only one scapula indicates an injury to what
Well,
nerve?
even if it was teres minor, that's part of the rotator.
That's still, yeah.
Oh, well, it'd be subscapularis is part of the rotator
If
cuff.
that was teres minor, yeah.
Uh-huh.
Winging of only one scapula indicates an injury to what nerve and what muscle? Well, it's not pec minor.
Yep.
And it's not your supraspinatus.
Mm-mm.
So it's either serratus anterior, but which one? So I guess just what muscle innervates the serratus anterior?
I'm pretty sure it's thoracodorsal, but we need to check.
Hello?
No, long third.
I feel like it might be long thoracic.
I was trying to study these sheets and I cannot find my shoulder eval sheet.
Oh god.
So that was
Screaming and crying.
really annoying.
Serratus anterior, long thoracic.
Long thoracic, okay. So I was wrong.
Well, we had it down to serratus anterior.
Hmm.
Drop arm test is used to determine injury to what muscle?
Well,
The drop arm test?
drop arm. Yeah, that's, when
That's
you
for
have
the
your arm.
shoulder.
Yeah, it's arm and abduction 90 degrees, and you bring it down. You're trying to.
Yeah.
I'm pretty sure that's supraspinatus because it's a primary abductor.
Yeah.
Long head of the brachii, that is a flexor. Teres major is a extender.
I think it has to be
and
supraspinatus.
Yeah, and deltoids kind of depends
That
on which
one
part is a
just chucked it
deltoid.
in there. Which of the following is not used to determine glenohumeral instability? The Allen?
Yeah, that's for thoracic outlet.
outlet. A grade 2 AC separation pathology includes.
I'm thinking this one's gonna be B because
it's only a partial tear. Because this would be grade 1.
well, it's isolatable because this your
Corticocranial?
yeah
Corticoclavicular.
yeah
CC.
corticoclavicular supports the AC,
Yeah.
and it kind of acts like a barrier. So
And
if
like
the
a
AC
partial
broke,
tear.
it would rip through that. And
Yeah, so it's not like a complete, but it is
Mhm.
a partial. There are 3 etiologies for AC separation: trauma to the lateral side of the humerus, trauma to the top of the AC joint, and foosh. Yeah.
Yep.
Foosh. True or false? Your patient will have painful response on both resistance to humeral internal rotation and external rotation. I wouldn't say painful.
let's
With humeral,
Don't-
when
I
performing O'Brien's slap lesion test.
O'Brien's is this one.
I just don't think they'll be able to do it.
Well,
You had an O'Brien's test.
I had an
done.
O'Brien.
Did
It
it
wasn't.
hurt?
It was never painful. But the question is, where I'm lost here is humeral internal rotation, which is
Yeah,
this,
Isn't that the
and
position it's
humeral
done in?
with humeral internal rotation and humeral external rotation.
I don't think you would have a painful response.
But
'Cause you
how
do
can
it-
you be in humeral internal and
external.
at the same
Isn't there a
time?
point where you do the test here and they should be able to hold it, and then when they rotate their hand, they can't do it, and that's how you prove that it is?
Yeah, that's how you.
But
yeah.
no to the painful response. Is there like a
Mm.
false? No. Okay, I just have to write it down.
Yeah, I think it might be the false up here.
I wrote it.
Whatever.
He knows what I mean.
Exactly.
Here you go, Brad. Look at my notes. I'm just calling Brad on the video. Sorry, Mr. J. Just lost all of our points.
Yeah. Now we fail.
Yeah, we just have to restart. Name 4 structures that would be damaged in pitcher's elbow.
Oh, the flexor muscles.
UCL.
Yep, UCL. Ulnar nerve.
Ulnar nerve. Pronator teres.
Mm-hmm. That's all 4.
Flexor muscles.
Awesome.
True or false? A drop arm test and empty can test indicate rotator cuff tears.
I mean, they're both tests for rotator cuffs. So, yes.
The anterior slide test is used to recognize long head bicep. Long head bicep tendon long irritation.
I would say no because that's how you test the joint capsule.
Yeah, glide is like for stability.
Mm-hmm.
So
Well, I mean, yeah.
false. I was gonna say no, but no. The Allen's test is used to recognize thoracic outlet syndrome.
Mm-hmm.
To perform the test, your patient turns their head toward the effective arm.
No, that's Adson's. Allen's is down and away. Adson's is up and 2.
Patient look away as you raise the arm. Yeah. False.
I know some of this stuff.
Yeah, cubital tunnel syndrome is irritation and damage to
The ulnar nerve.
The pronator teres.
That'd be pretty impressive.
Yeah.
And it's pretty crazy when they do cubital tunnel releases.
I've never even heard of that, I'll be honest.
You know what carpal tunnel releases do?
Yeah.
They do it here for carpal tunnel. They do it back here for cubital tunnel.
Ugh. Functional shoulder movements include all the following except
C, because it's a 2-to-1
it's
ratio.
not 1-to-1. Panner's disease is?
It's kind of like a precursor to. I looked this
Isn't
up in the book. It's like a precursor to
Like arthritis, I thought.
Little league elbow. So
It is
basically,
a precursor
it's
to
a
it?
precursor to it.
Okay, that's where I didn't know that it was in children. So
Yeah.
B. It's osteochondritis dissecans.
I'm not sure if you talked about that one though.
I remember looking at it, like seeing it in the book, but
Yeah, I looked that one up, and basically, if they stop doing it after a while, then it'll
Yeah.
stop it.
Lateral
Lateral
epicondylitis. Too large, too small, faulty technique.
It's too
Too
large
large?
because we
'Cause that
talked
would
about,
help it.
yeah.
Name the 4 muscles of the rotator cuff along with their motor function and action.
Which order you want to put them in?
I'll do teres minor.
Cool. Subscapularis, and then supra and inferior spinatus.
Supra.
Mm-hmm. And infraspinatus.
Infra. I wonder if I wrote stuff down. It would be amazing if I did.
Well, I mean, so is he looking for or
It just says, what is the motor function and / action? The function of the subscap is internal rotation? No, this is the one.
Subscapularis is the first 30 degrees of abduction, and it's an overhead.
Isn't that supraspinatus? Supraspinatus is first 30 degrees of flexion, right?
The first 30 degrees of subduction. Subscapularis is an internal rotator because it comes through and it's part of the anterior 1/3 of the rotator cuff.
Internal rotation.
Mm-hmm. Teres minor was an external rotator / extender. Right, because it's on the back. And
external rotation, horizontal abduction. Teres minor.
Wait. Did you? No, supraspinatus is. Yeah.
Oh.
Okay. Sorry. No, supraspinatus is your abductor.
External.
Sorry.
You're good.
I thought you put them. I couldn't read them.
I have really tiny writing. And then
Subscapularis is the internal. Yeah,
Supraspinatus.
supraspinatus is your abductor and overhead stability.
right. First 30 degrees of flexion.
Isn't it abduction?
I have flexion.
First 30 degrees of abduction
Yeah,
is done by
flexion.
flexion.
Yeah, abduction.
Abduction.
First 30 abduction.
Mm-hmm. And infraspinatus is your lateral aspect of your 1/3 of. So this is
Infra.
wait. So let me make sure we got all this right. So subscapularis goes to the lesser tubercle, so it's your internal rotator. Teres minor is your lateral 1/3 of your rotator cuff. Supraspinatus is your middle, and then infraspinatus will be your anterior 1/3, right?
Middle 1/3. Greater tubercle. You mixed up infra and supra. I think.
Infra and supra, I split those. Okay. So supra is your anterior 1/3.
Right.
And okay, that's
Infra's
right.
middle 1/3.
That's right.
So infra is
If it's
an
the middle,
external rotator, right? I might have mixed those two up in here though. Probably check the book. We're looking for supraspinatus abduction.
Yep.
Oh, we're
That's what I
looking for
put.
infraspinatus.
But- Hey, but double checked ourselves that one.
That's true.
Spinatus.
Okay, infra is external rotation.
Okay. And abduction. That makes sense.
You say AB.
Mm-hmm.
Let's look back at the other ones.
I'll go double check.
Subscap. Internal rotation.
Mm-hmm. Supraspinatus. I know it says abduction, but it's the first 30 degrees of abduction, and it's not really an external rotator. That's the big part.
And then teres minor, external rotation.
Mhm.
Yeah. Okay, so
Okay. It's always nice to use that as a double check versus a.
just YOLOing it. Name 3 structures that pass through the thoracic outlet.
Brachial plexus,
Okay.
subclavian artery and vein.
Is that one of them or both?
I'm not sure. What else would be a good one that goes through there right there? Because there's I mean, that's really the big components of that thoracic outlet.
Oh, a man throwing. I think I'm getting into like images. Subclavian artery.
Subclavian twisted hand. Yeah, it's not really have this one doesn't really have much on.
Show me your thoracic outlet.
You just have you have your notes on it? Because it's in our.
Let's see. It would be amazing if I actually wrote that down though.
Yeah, I can't find any of my shoulder stuff. Don't know what that happened at all. Super annoying. All I can find is old ones that like weren't saved.
Yeah.
So it's like before the information. Just drop our test.
Yeah. I'm looking for. I don't have it.
Okay, I'm sure we're good with those three then. Artery and then the vein.
Okay.
Because those are the three ones that you're worried about. Like if someone gets like a posterior break, subclavian
Nerve.
That's the brachial plexus. Subclavian vein and artery. There you go.
True or false? Coracobrachialis muscle testing is performed in the plane of the scapula, while anterior deltoid testing is performed in a straight plane in forward flexion.
Anterior delta, correct. Coracobrachialis. I mean, that would make sense because coracobrachialis is your main primary flexor.
Yeah. Shoulder evaluation.
Yeah, it would make sense because if you're.
What are we looking for? Coracobrachialis. In the plane of the scapula. And then anterior deltoid.
Anterior deltoid's straight.
Yeah, true. I'll just write it really tiny. A patient of yours is a baseball pitcher, and an MRI of their throwing shoulder has recognized a lesion near the insertion of the long head of the biceps.
Oh, did you add the fixes email he sent in? There was 2 questions that he sent an email of.
Yeah, I'm pretty sure I edited it.
Okay, cool.
I put those in.
Tweet. Just make sure. Sorry.
You're good. Has a lesion near the insertion of the long head of the biceps, and this verifies slap. Yeah. Superior labrum, anterior to posterior. True.
We were talking about how sometimes they'll go and they'll snip that tendon so it doesn't pull.
True or false? Your patient complains of cold hands, poor cap refill of the fingers, and absent radial pulse during your Allen's test.
Yeah, there's the wrist Allen's test.
Yeah. A positive indicates that they have thoracic Allen syndrome. You should work on stretching their scalenes.
No, scalenes are neck muscles. We need to work on.
Isn't scalene a part of it?
I mean, not really. I mean, your scalenes are your major neck muscles. What we need to fix are improved strength in upper trap, rhomboids, stretch, and the pectoralis minor and major.
There is one where the scalenes are part of it. I just can't remember which one. Is that maybe? There's thoracic outlet.
Scalene is when we did the trap test.
Yeah.
Because that's part of it. Scalenes will also do that.
Thoracic outlet syndrome. Tight scalene muscles.
How did I not get that in there then?
I guess it doesn't mean you need to work on your scalene muscles. That doesn't fix the problem.
I feel like this could be a true and then, but you should,
Yeah, there's you could do more.
Yeah. Yeah. Some of these ones are like, yes, but.
True, ... True or false, the long head of biceps tendon should be aggressively strengthened immediately. No.
No.
The phrase aggressively strengthened immediately.
Yeah, definitely need to let it cool down, get some NSAID going.
Okay, your patient's complaining of clicking in the glenohumeral joint during circumduction and rotation.
So that's the grind test.
The grind test. You decide to perform an O'Brien's test in order to rule out a lesion of the labrum. Your patient resists a brake test with forward flexion of the humerus while their hand is internally rotated. This causes pain in the glenohumeral joint. You perform the same motion with no pain on the humerus and external rotation. This is a negative result. What's the question? Is that right? Maybe they're asking.
No. If patient's in a supine position, adduction 90 degrees, if you test it, you're doing the internal rotation.
This causes pain. You perform the same motion with no pain while the humerus is in external rotation. This is a negative result.
Which means your pain is your internal rotator abduction, which would tell you it's a muscle test or You just resist the break test, so that's good. What test?
I don't think that would be a negative result then. It's not asking for what test it is. It's just saying, is it right or not? This is a negative result. I think it's not negative.
Okay, I'll trust you on one.
We'll just YOLO this one.
Cool.
The ligament that stabilizes and encircles the head of the radius. It's the annular ligament. Yeah.
But also then look at the first one. We have like question like 7 or whatever.
Yeah, well,
because that's what I was thinking.
the ligament that stabilizes and encircles the head of the radius and also blends into the radiocollateral ligament. I mean, if it encircles the head of the radius here, it has to here too. That's just weird that he said it twice.
Why are you messing with us? You have a good time hurting our feelings?
This is a game. Annular ligament it is. If it's wrong,
I'm gonna cry.
you're mean.
And you're gonna have the idea that a 30-year-old man is crying because of your questions.
If resistance is applied to an athlete's hand while moving into extension with the elbow straight. Athlete's hand into extension with the elbow straight. Is that
lateral epicondylitis?
Is it lateral?
Yeah, because that's like the other one we were talking about earlier.
What the hell is medical epicondylitis?
Is that a typo, or are you just messing with us again?
Are you trying to get me? The shadows on my face make me look really old.
My face just makes me look old.
It's okay.
It's okay. I've got experience and stuff.
We say lateral, right?
Definitely.
Not medical epicondylitis.
No, hopefully not that one.
The adolescent athlete who complains of pain and locking the elbow joint. Locking.
Pain locking. But here's
Osteochondritis dissecans.
But
Adolescent athlete.
sudden
pain.
Osteochondritis dissecans is slow
like
over time. It's an arthritic change.
Locking.
I'm thinking it's a fracture because that's gonna.
Super
One day it does, or the
common.
next day it doesn't.
Yeah.
Or reverse that.
Yeah, I know what you meant. Right, because osteochondritis dissecans is like slow. It's like arthritis.
It's an arthritic change.
Arthritis.
Yeah.
Okay. You break your humerus and it hurts all of a sudden.
Yeah, that would make sense.
That makes sense. If I break something, it hurt. Okay, if an athlete complains of burning and tingling or paresthesia, the 4th and 5th fingers, what structure may be damaged?
Ulnar nerve again?
Didn't we just answer this? Okay. I feel like I'm in the office.
I was just thinking the same thing.
The most elbow dislocations result from falling on an outstretched hand. Posteriorly.
Yeah, because you can't really dislocate anteriorly.
I've never heard of it.
Well, it'd be pretty interesting. You'd have to literally break it through your hand.
Literally.
That'd be bad.
Most elbow dislocations. Oh, possible complications of humeral fracture, muscle spasm, swelling, and bone pressure on the brachial artery, which inhibits blood circulation of the forearm, wrist, and hand. This is compartment syndrome?
Yeah, Volkmann's. Volkmann's is compartment syndrome in the arm.
That's true, but it doesn't say anything about the posture of the hand.
But it would cause that because of the stress on the nerve.
On everything?
Yeah, because the hand's, that's a muscle.
Right.
Spasm.
Oh, yeah, muscle spasm. The distal end of the humerus forms 2 condyles. The lateral condyle is the capitulum, the medial condyle is the trochlea. Yeah? Yeah.
No.
Not the trochlea?
No, this is what we were talking about with him.
Of the humerus? Oh.
Stick with me here.
The trochlea is of the ulna.
Not the, no. Not these, because he's asking us about the condyles. These are the condyles
Up there.
from because he likes this style. The capitulum and trochlea are these.
The 2 little ones.
The 2 gaps between, not the actual condyles themselves.
Oh, right.
But that's the way they talk about it
In the other book.
In the other book.
Okay.
Yeah, not in Hot and Cold, but in Starkey.
Starkey Brown. Visually observing the elbow at a 45-degree angle of flexion will show the olecranon process in both epicondyles in a straight line. It's more of a triangle, isn't it? Yeah, on elbow. Is that a straight line?
Straight line is in what direction, though?
I mean, it's straight.
I mean, like, sure, on a horizontal plane, but it's not vertical, and even...
Yeah. I think so because when I remember he's like, oh, when you have a dislocated elbow, like you can tell because your 3 points aren't in a line. Or was he saying alignment? He was definitely saying in a line.
No, it makes sense because if we're cutting across this way,
Then-
they're all in a line because if it's dislocated, it'll be out and you have a triangle.
Yeah.
Okay, I like that. We can go true.
True. Logic.
Mhm.
Strain of the muscles of the elbow can be caused by hyperextension forces.
I mean,
No.
I mean, beyond like
Muscles
having
of the elbow?
a stretch reflex,
Yeah.
and then you have.
I've never hyperextended my elbow. I
Well, you
do
really
a lot
can't
of elbow
because-
sports. Like I think it's
Well,
more
because
this.
the olecranon gets stuck in the fossa, so it doesn't really
Yeah,
the cubital fossa. So
No,
yeah, I'd say no.
it would be. Yeah,
Yeah.
no. The mobile wad of 3 could potentially cause lateral epicondylitis. What the hell is the mobile wad of 3? No, I remember us talking about it. Wait.
Yeah, no, definitely.
Sorry, I swear I know what I'm doing.
I think he knows that because we generally have more idea what's going on than most of the kids in the class.
We're just dissing on everyone in the class right now. Eat this.
Yeah, we think some people in the class don't know what the hell's going on. I said it.
What was I looking up? The mobile wad of 3? Okay, that's in the elbow, right?
Mm-hmm.
I feel like I remember writing it down, but I just don't know where. What the hell is the mobile wad of 3? I'll give you $1.50 that it's in this stinky little green book. Thank you.
Well, what of 3 is the brachialis, extensor carpi radialis, and brevis.
Aren't those all lateral?
So your brachioradialis, and then extensor carpi radialis, longus, and brevis. Yes, these are all.
So that could be part of lateral epicondylitis, right?
Mm-hmm.
Cubital varus is an abnormality. No,
It's valgus.
Also, varus stress from the elbow from throwing a baseball contributes to
It's valgus
It's
again.
valgus. A positive shoulder grind test indicates a torn rotator cuff. I thought so. Oh, that's Outlook, not my email. We don't want to see my email, we want to see Word. We are looking for the shoulder evaluation.
Special test.
Ligamentous testing?
Mm-mm.
Muscle testing?
Special test.
Special test.
Special test. Rotation or grind. There it is.
Do you see it? I don't. Test
Rotation,
the-
relocation, compression, rotation, grind. Test of labrum.
So it tests for labral tears,
Mm-hmm.
not
Not
rotator
rotator,
cuff.
cuff. That's what we have all the other ones for. Speeds and Hawking Kennedy and all that.
Speed. The subtendinous burst is the most frequently injured burst in the elbow because it's so superficial.
No, that's the old cranium.
Subtendinous burst
Yeah,
is
that's
the
one's-
fakest word I've ever heard.
Yeah, that's the one that's literally in your electron process.
Literally. The radial collateral ligament does not attach to the radius. Why wouldn't it? Where's the radial collateral ligament?
I mean, it's got the three portions. You got the anterior, posterior, and nular.
Yeah. Show me my elbow.
Right there.
I was looking at that. Okay. I hope you have a great night tonight in that car.
I'm gonna go home and take care of the puppy and stuff.
Oh.
Poor dog. He was like sitting there shaking. He was all wobbly.
Not a fan of the vet. I take it.
Well, he was shaking all the way there, but now he's like all messed up, coming out of like anesthesia.
Oh, yeah, the surgery.
Mm-hmm.
Okay.
But he's a good little.
Radial. I mean, it doesn't attach directly
Well, yeah, right
to the
here. You have
radius,
your.
but it does.
You have your anterior and posterior portion. Your anterior literally connects to the head of the rotation, and then it can torque.
Yeah,
Otherwise,
why
your
would
radius
the
would
radius
literally
be
just.
free to rotate?
Yeah. Well, it's free to rotate, but
Not like in the way that I think it's inferring, right? Because it's,
I mean, it has to be free to rotate
yeah,
because it's literally the entire purpose of the radius.
right, free to rotate, but it does not attach, which is false.
Well, it does attach.
It does attach, but it is free to rotate.
Yes.
So falso. Yeah.
Falsetto. So it's gonna be.
The proper first aid management of posterior dislocation of the elbow is to assess the distal pulse, assess cap refill, assess distal dermatomes, assess ROM. No.
Yeah, no. That's a terrible idea.
This isn't even a true or false. No. A positive posterior glide of the glenohumeral joint would indicate
Damage to the posterior.
Wow,
That was
it's
nice.
almost like we finish each other's sandwiches. That's what I was gonna say. The tapping sign over the transverse carpal ligament. Was it carpal tunnel syndrome? No. What's the tapping sign?
Transverse. Well, you've got your transverse carpal ligament right here, and that's what they do. They do a good tunnel sign right there to see if they can aggravate it. So, I mean, that would be a carpal tunnel syndrome.
Yeah, I don't see why. I don't
We just haven't really talked about it yet.
Yeah, ganglions are like
Yeah, that's
neural.
part of the CNS. You're trying to trick us up with hand questions, sir.
Oh, we're almost done. Tennis elbow and golfer's elbow are common names for medial epicondylitis.
Isn't golfer's elbow lateral?
Lateral, I thought. Is it? We can check.
Wait, I think.
Elbow.
No, tennis elbow is lateral, because we talked about that, and you can use.
Oh, it's the backhand.
It's the backhand, and then they talk about you getting a larger grip, which shortens
for
the length.
Flexors.
Mm-hmm.
And then
Your
golfers.
extensors. Yeah, and then the golfers, that's what we're talking about in class, where
it can't be
there's not
medial
enough flexibility,
epicondylitis.
so they just kind of swing through. That's why they.
So it has to be false, because tennis elbow is lateral. Also, golfer's elbow is commonly caused
that's fun.
from lack of core flexibility.
Yes.
Yeah. Scapular ring is caused due to weakness of the pectoralis major.
No, because that's a
girl.
primary abductor.
Also. Okay. Do we
Awesome.
want to go back and look at any of them?
I just number 11 and number
11.
everything else. Yeah, it was the one. It was the two that were both the annular
Same
ligament.
ones? Okay.
Outside of that, I feel good about everything.
Yeah. Ligament that stabilizes and encircles the head of the radius and also blends into the radial-collateral ligament. I just don't know what else it could be, but the question's in there twice and worded differently.
So I don't know if it's like they're both positive, and both true, or this one's more like this because of that.
I see what you mean. Okay. It's 11 and 40 that we need to look at.
Okay. Well, here's the part that's stripped up. Okay, this one is encircles the head. Yes.
Yes, this is definitely
That
the
has to be
annular.
annular.
So this is definitely right.
Yeah.
It's
that
this one. Also blends into the radial collateral ligament. Look at the book, maybe. Hey. Okay, those are about the wrong part. Okay, radial collateral ligament.
Close relationship between the humeral and radial articulating surfaces. Encircling the radial head, the annular is a fibrous structure that permits internal and external rotation on the radial head and on the capitulum of the humerus. Both ends of the annular ligament attached to the coracoid or coronoid process and form 4/5 of the circle. The remaining 1/5 of the circle is formed by the radial notch. Articulation receives additional support from attachment to the radial collateral ligament. I mean,
it doesn't confirm or deny what we said. Because the thing is, it still circles the head of the radius, and what other ligament does that?
I hate that. That's literally the point of the annular.
Yeah. And it blends into the radial collateral ligament, right?
Let me just.
Is the quadrate ligament a real thing?
Mm-hmm.
Where is it? Where is it? Bold of me to open my mouth and tell you that it's not a real thing. Oh, it's so frustrating. Okay, so maybe. Maybe 11 is the quadrate ligament then, because it has another function.
Right? And you see where I was tripped up earlier?
Yeah, what the hell? So this one is B.
I say send it.
Yeah, because this one is right.
It feels really good, and then that
And
one
then
feels
this
sound
one
as
is-
good, but so it's like
We're just gonna.
pick B unless
Sorry.
A was correct, in which case that's
Yeah.
what we meant to do the first time.
Actually, I'm not that sorry, but okay. I feel like that's a lot better.
All right.
Bye.